Since 1979, when Kemri was first formed, we've gone through many, many cycles of growth. And currently, Kemri has established a total of 7 research programs. And these programs are the ones that provide oversight about the areas that Kemri must be able to address as priority areas. Of course, guided by Ministry of Health, and also the Health Act, which then guides us in terms of what areas to put effort and energies and funding to respond to the country's needs for health. We then have also grown a lot in terms of physical presence in the country. Beginning at the very start when we were established with 5 centers, and now we are a total of 14 centers. These are the physical places, just like here, where we have the Kemri Kilifi laboratories center placed. We have now a total of 14 of these, and they are all working towards addressing the various research needs for the country. And when we say research needs, these are very, very broad term. We're looking basically at both infectious diseases, but also non-communicable diseases. And if I may give you examples, various examples. Malaria, which is one of the diseases that is endemic in Kenya and the region, Kemri has been in the forefront of ensuring that we get the best medicines for treatment of malaria. We have been in the forefront of providing prevention for malaria, including developing bed nets, treated bed nets, and substantively being able to reduce the incidence of malaria now by nearly 45% in some places, 50% in other places. It's all because we have been at the forefront of carrying out cutting-edge research to be able to respond to public health needs for this disease. TB, same, being able to be at the forefront of reducing treatment regimens that took nearly a year, now to regimens that will take approximately 4 months to be able to complete. That's a major breakthrough. We have also recently, as we speak, launched a clinical trial where we are being able to provide treatment or drugs for young children who have a disease we call schistosomiasis. You are aware about kichocho, this in Kiswahili. This is a disease that is very, very debilitating. Affects young children and adults alike, and then they have lysis of blood cells, and they see red urine, or what we call blood in urine. And now we have treatment that is appropriate for children. We didn't have that before. Now we have that clinical trial happening. We have a clinical trial happening for a vaccine in malaria. And this vaccine is going to reduce or prevent malaria in around 55% of those that receive it. That's a major breakthrough. And we are having this clinical trial happening in endemic areas like the western part of the country. And this, when it's concluded, will provide us in Kenya and the region with a new tool for prevention and control of malaria. The other area that we are working in, as an example, I mentioned about a new, slow, but very silent pandemic, and that's the pandemic of cancer. We have a lot of new cancers that, of course, a lot of people will argue maybe we have had new technologies for diagnostics, so we are seeing more, we are able to detect more cancers, but nevertheless, that is a slow pandemic that has been growing. And what we've done as Kemri is to go back to some of these areas that we have hotspots and look at some of the risk factors. What are some of the host risk factors in the human? What are some of the environmental risk factors? What are some of the genomic or genetic backgrounds to some of these cancers? And we want to understand that so that we are able now to appropriately respond to various cancers. And we want to utilize some of the tools that we have for other diseases to be able to use them for appropriately responding to cancer. We want to use genomics, what we call genomics, or genetics, understanding genetics of cancer, to look for markers biomarkers, what we call biomarkers, that once we identify that biomarker in a host, in a human host, we can then be able to use that biomarker to quickly be able to diagnose certain cancers. Because for cancer treatment, the most important thing is early detection. If you're able to detect or diagnose cancer at stage 1 rather than stage 4, you can then give appropriate treatment early, and that you get better outcomes rather than waiting very late. And those simple tools we call biomarkers are the ones that you can be able to look out for in a patient and be able then to provide adequate treatment. Secondly, some of those biomarkers will be able to advise on the appropriate treatment. Is this patient appropriate for radiotherapy or chemotherapy or a combination? These are some of the things we are also doing at the moment. And we are doing that in collaboration with the National Cancer Institute. The other area that we really are very, very keen on is in the area of treatment of infectious diseases. Those of you who have been able to follow scientific developments understand that we have a big problem in diseases that are not responding to treatment. We call that drug resistance, or in scientific terms we call it antimicrobial resistance. And this has been growing over time to the point that you find in certain diseases like acute respiratory infections or diarrhea caused by cholera or caused by E. coli or Shigella. These are some of the bugs that cause diarrhea, do not respond to first-line treatment. Up to 60-70% don't respond. And this has been largely due to the fact that antimicrobial resistance or drug resistance is being driven by our own actions, misuse of antibiotics, abuse of antibiotics, counterfeits that come to the country, which means they are very, very little of the active agent. So you take them, but there's nothing that is active against the disease that you are treating. And we have a large project that is targeting major referral centers in all the regions. And we want to build capacity in human resource to be able to do surveillance in antimicrobial resistance, to be able to detect antimicrobial resistance early and know whether this drug will work or not, and be able to report that appropriately to those taking care of patients. And we want to move on with the counties, and we want to move on with the referral centers, the referral hospitals and facilities, to be able to adopt a system of surveillance that is continuous and able to detect those antibiotic resistance genes in several of the commonly occurring diseases, so that we don't just keep treating people and they're not getting well, and then they come back to the community, they spread that resistance, because that spreads very, very quickly. That is one of the capacities we want to build. Currently, for example, we have taken part in the COVID-19 vaccine clinical trial. And some of you may ask, why are we doing that, and we're already receiving this vaccine? True, yes, we have been receiving this vaccine as part of what we call emergency use approval. Why? Because we are in a pandemic, and if it has been seen that it works a bit, we'd rather have something that works a bit rather than nothing. So we are in that situation. A lot of clinical trials have been concluded in other countries that started earlier than ours, but we're also nearly concluding ours. Actually, by the end of July, we'll conclude ours. And the purpose of that is to be able to look at the local host conditions as we conduct our own clinical trials in our own populations, because we are all different from different regions. Our immune systems react differently due to our own local environmental conditions. So we must be able to conduct those clinical trials within our own setting to understand how drugs will work. The malaria clinical trial is also under phase 3, what we call clinical trial phase 3. And that again will be concluded before the end of the year. And we'll be able to know for sure that once we deploy this vaccine in Kenya and the region, it will at least prevent malaria to 55%. The drug for schistosomiasis also with GSK, again that will be concluded before the end of the year. Is also a clinical trial phase 3, and again that also will go a long way in being able to give assurance to our population that this drug works within our population here. So those are some of the timelines we have for some things. And we have recently also done another product we call VTM, Virus Transport Media. It's a medium that is used for transporting materials to the lab from individuals who require to be tested for COVID-19. So that material was not there. We didn't have. We tried importing, it was impossible because nobody was exporting things. The same way you see that nobody wants to export vaccines because their countries have problems. They want first to deal with their populations. So even for this media, we couldn't get in. So we had to innovate our own transport media, and now we are exporting it to countries in the region. So for us, it's a big moment, and it's a big, I would say, achievement for Kemri, because we have now been taught to look inwardly for our own solutions. The last product is what we call a PCR kit for detection of COVID-19. It's not different from what we import. But can you imagine that by utilizing our own PCR kit, we'll be able to cut the cost by 50%? Yeah, and yet it was within our power to be able to do this, but I think our mindset has always been go the easy way. There's always a product, let's buy it and use it. But now we have our own product. We want to develop it to commercial level. We want to partner with the Ministry of Health so that as we roll it out, we tell the Ministry of Health, yes, we have our own kit here, help us produce it en masse, help us produce it in bulk and supply it to other labs at a cost that is going to be 50% of what you use to import the other kits. So Kemri is a national research institute. It supports the Ministry of Health, the country, and actually the region. Right now, as we speak, we receive samples from Somalia, we receive samples from Mauritius, from Madagascar and other places, from Burundi, from Southern Sudan. All these are being tested within Kemri, one, routinely, but also for purposes of quality control. We also are a regional quality control center for malaria, what we call malaria panels. We then support those countries in the region to be able to develop a quality control system for testing of malaria for their region.